Gentlemen, what if a $10 bottle of oil applied to 2 forgotten spots on your body could change everything in the bedroom? I realize that sounds exactly like those ridiculous internet ads, but stay with me, because what I'm about to share has actual science behind it. And it works when you do it correctly. I'm Dr. Sophie Morgan, board-certified urologist. 12 years helping men past 50 reclaim what they thought was gone forever. Today, I'm revealing a technique most doctors either don't know about or won't discuss. Why won't they discuss it? We'll get to that shortly. But first, smash that like button, hit subscribe, and tell me where you're tuning in from. United States? Canada? Kenya? Philippines? Australia? Here's what you need to understand. Everything changes after 50. Testosterone drops 1% every year after 40. Blood vessels lose flexibility, get rigid. That prostate? Growing quietly for years, putting pressure on structures it never touched before. Layer on hours of sitting daily, chronic stress, extra weight accumulating, and sleep interrupted multiple times nightly from urinating. Suddenly, the bedroom situation isn't what it used to be. But here's what almost nobody understands. This decline isn't inevitable. There are 3 factors controlling erectile function: blood flow, pelvic floor muscle tone, nerve sensitivity. All 3 can be restored at any age. You're not beyond repair. Your body just needs the right support. Most men believe they have 2 choices: take pills and deal with side effects, or accept this is just how things are. But there's a third option: natural approaches that address root causes instead of masking symptoms. Before I tell you which oil and where to apply it, you need to understand why this works. Because there's one critical mistake that ruins results for most men. I'll explain that mistake later. First, the foundation. Your pelvic region changes as you age. Skin gets thinner, drier, more easily irritated. Daily friction from sitting, moving, and intimacy creates chronic inflammation. You don't feel it as pain, but your body responds by tightening everything up, restricting blood flow, creating muscle tension. That's where the right oil becomes powerful. Not just any oil, a specific type. When applied correctly, 2 things happen. You reduce friction. Second, the oil penetrates through skin and affects tissues underneath: blood vessels, muscles, nerves. It increases circulation, calms inflammation, helps tight muscles release. Here's where most doctors won't go. The oil is castor oil. And there's a reason the medical establishment doesn't promote this. It's cheap, natural, no prescription needed, no profit motive in telling you about a $10 solution. But castor oil has been medicine for thousands of years. Ancient Egyptians, traditional Chinese medicine, Indian Ayurvedic practices. Completely different cultures separated by oceans and centuries all recognize something special. Modern science finally figured out why. Castor oil contains extremely high ricinoleic acid. This unique fatty acid makes up 90% of the oil. It's a potent anti-inflammatory. When absorbed through skin, it reduces swelling and irritation in deeper tissues, but it also dilates blood vessels, opens them up, allows more blood flow. For weak erections, that's exactly what you need: more blood, oxygen, nutrients, reaching tissues that matter. There's also an effect on your lymphatic system. Many men develop pelvic congestion as they age. Castor oil helps clear that out, reduces that heavy, swollen feeling. If you can't use castor oil, coconut oil is backup. Natural, antibacterial, decent absorption. Some prefer almond oil for vitamin E, but for maximum impact, castor oil is unmatched. Any pharmacy carries it. Organic, cold-pressed. $10 to $12 for months of supply. Let me tell you about Michael, 62, who came in 8 months ago exhausted and frustrated. He said, "Dr. Morgan, I've dealt with this 3 years. Pills work sometimes. Other times, nothing. Even when they work, pounding headaches, bright red face, completely clogged sinuses." Michael's health was decent. Blood pressure, controlled, reasonable cholesterol, enlarged prostate, but normal for his age. The issue was purely functional. Blood flow restriction, muscle tension, chronic inflammation in pelvic tissues. I taught Michael this exact technique. He was skeptical. Rubbing oil on myself is supposed to fix 3 years of problems, but he committed. 3 nights weekly for 1 month. Week 3, Michael messaged me. Morning erections were back, stronger than 2 years, only waking once nightly to urinate instead of 3 or 4 times. Better sleep, better energy. Week 5, successful intimacy without pills. 2 months later, Michael looked completely different. More relaxed, confident. He said, "I didn't realize how much this weighed on me until it wasn't a problem. I feel like myself again." All right, where exactly do you apply this? 2 specific zones. Zone 1 is your lower abdomen, the area directly above where your penis connects to your body. Under that skin, you have the base of pelvic floor muscles. Below that, major arteries feeding blood to your penis. Massaging oil here influences circulation and helps muscles release chronic tension. Zone 2 is your perineum, space between scrotum and anus. This spot sits directly over your prostate, where pelvic floor muscles are most accessible. The pudendal artery, supplying most blood to your penis, runs right through here. Massaging reduces prostate congestion, improves blood flow, releases deep muscle tension. Quick poll, had you heard about perineum massage before this? Comment 1 if yes, 0 if new information. Here's the technique, 5 minutes total, right before bed. Timing matters for reasons I'll explain shortly. Take 1 teaspoon castor oil, warm it between palms 15 to 20 seconds. Do not skip warming. Cold oil doesn't absorb well and is unpleasant on sensitive skin. Start with lower abdomen. Fingertips, gentle circular motions. Work oil into skin just above pubic bone. Steady pressure, nothing painful. 60 seconds. You'll feel warmth spreading as circulation increases. Shift to perineum, middle and ring fingers, gentle pressure, small circles or rhythmic back and forth, not deep tissue work. About 5 out of 10 pressure, just enough to feel it working. 2 to 3 minutes here. Here's the critical mistake most men make. They rush it. Think more pressure, less time gives faster results. Wrong. Gentle, consistent pressure for full time allows oil to penetrate and tissues to respond. Rushing ruins effectiveness. Some men feel immediate warmth. That's blood vessels dilating. Others feel relaxation through whole pelvic region. Both mean it's working. Why nighttime? Your body operates on circadian rhythms. Nighttime is when repair happens. Between 10 p.m. and 2 a.m., testosterone peaks. Growth hormone surges during deep sleep. Blood pressure drops naturally when lying down, allowing better circulation. When you do this before sleep, you're setting up optimal conditions, increasing blood flow and reducing inflammation when repair systems are most active. Oil continues working throughout the night. Morning erections are your body running a system check. With consistent routine, most men report stronger morning erections within 1 to 2 weeks. Objective feedback that function improves. Frequency matters. Don't do this nightly. Too much irritates skin. Start 3 nights weekly, Monday, Wednesday, Friday. Commit 1 full month, track changes, morning erections, urinary flow, confidence. Some find twice weekly sufficient after seeing results. Others prefer every other night. Listen to your body. If skin feels irritated, back off. If getting great results, 3 to 4 nights weekly is ideal. Which schedule sounds realistic? Drop 3 for 3 nights weekly or 4 for every other night. Consistency is key, not a one-time fix. Regular practice over time builds results. Most notice changes within 1 to 2 weeks. More significant improvements after about a month. Benefits often extend beyond erections. Working around prostate improves urinary symptoms. Midnight bathroom trips often decrease from 4 or 5 to 1 or 2. Transforms sleep quality. Connection to lower back health. Pelvic floor muscles attached to lower back. When chronically tight, contributes to back pain. This massage releases tension. Many report back feels better after weeks. Most important benefit is psychological. When you know things work, when you're not constantly worried about performance, everything changes. Confidence increases. You carry yourself differently. Feel more connected to vitality you thought was fading. Safety notes. Not a replacement for medical evaluation. If you have serious erectile dysfunction, pain during sex, blood in urine or semen, see a doctor. This is optimization, not treating serious conditions. If on blood thinners, be extremely gentle or avoid perineum area. Increased circulation could cause issues if blood doesn't clot normally. Always wash hands before and after. Don't share oil. If you feel unusual lumps, bumps, or persistent pain, stop and get checked. Keep expectations realistic. Not pharmaceutical, won't do this once and feel 25. Gradual improvement with consistent practice. One piece of larger vitality strategy. Make this stick by tying to existing nightly habit. After brushing teeth, during wind down. Keep oil bottle visible, nightstand, bathroom counter. Set phone reminder first 2 weeks. Warm oil bottle in hot water for a minute before using. Warm oil feels amazing, makes experience pleasant. Aging doesn't mean accepting decline. Your body can maintain and improve function into later years. Just needs right support. 5 minutes, 3 nights, weekly, 15 total minutes out of 168 hours to potentially improve erectile function, reduce prostate symptoms, sleep better, feel more confident. Castor oil costs $10, lasts months. Minimal time investment. Substantial potential upside. Virtually no downside following guidelines. My challenge. Commit 30 days. Buy organic castor oil. Block 5 minutes, 3 nights weekly. Actually follow through. Keep simple notes. Energy levels, morning erections, sleep quality, confidence. By month's end, you'll notice enough improvement this becomes permanent routine. Your best years aren't behind you. With right knowledge and consistent action, you maintain strength, confidence, vitality into later decades. This is one powerful tool too few men know exists. If you found value, share this with someone who could benefit. Subscribe for practical men's health content beyond generic advice. Leave a comment. Tell me if you're trying this. Ask questions. Age is not the end of vitality. Small, consistent actions create lasting change. I'm Dr. Sophie Morgan, and I'll see you in the next video.